Welcome to the educational module Introduction to the Internet of Things of Sending Vet program. The current section introduces the IoT devices in a healthcare IoT solution. Healthcare IoT. Healthcare is the maintenance or improvement of health via the prevention, diagnosis, treatment, recovery, or cure of disease, illness, injury, and other physical and mental impairments in people. It is delivered by health professionals in allied health fields. In the category of health professionals includes the physical therapy, dentistry, pharmacy, midwifery, nursing, medicine, optometry, audiology, psychology, occupational therapy, athletic training and other, are all included in the part of health care. All this work is able to provide primary care, secondary care, tertiary care, and public health. Healthcare IoT, or the Internet of Medical Things, IoT, is the combination of the traditional healthcare and the Internet of Things technology. Here, medical devices and applications that are connected to the healthcare IT system collect data through online computer networks. In more detail, the medical devices are equipped with Wi-Fi that allows the machine-to-machine communication, are linked to a cloud platforms where their collected data are stored and analyzed. Here we will discuss about different examples smart devices used in healthcare IoT. The examples mentioned are remote patient monitoring, glucose monitoring, connected inhaler, connected contact lenses, smart watches for depression and Parkinson patient monitoring. Remote patient monitoring. Remote patient monitoring. Remote patient monitoring is one of the most important characteristic provided by healthcare IoT. Remote patient monitoring, or short for RPM, is the technology that enables monitoring patients outside of conventional clinical settings. The monitoring can take place in the patient's home or in other remote areas, which is able to increase the access to care and at the same time decrease the healthcare delivery costs. It is important to mention that remote patient monitoring for chronic disease management may be able to provide significant improvement for individuals' quality of life. The care in these situations are delivered through telecommunications, which is particularly important for patients that manage with complex self-care processes. A key feature of remote patient monitoring, such as remote monitoring and trend analysis of physiological parameters, are able to enable early detection of deterioration and as a result reduce emergency department visits, hospitalizations, as well as the duration of hospital stays. RPM example. The ELISA remote patient monitoring is a system that automatically transfers selected test results to healthcare professionals. The system is designed to track asthma and INR, and the healthcare professional can promptly react in the view of changes, if it is needed. How does ELISA RPM work? The ELISA RPM consists of three components: a smartphone application, a Bluetooth-enabled device, and an interface. The patient poses the smartphone application and the Bluetooth-enabled measurement device, whereas the healthcare professional uses the management and monitoring interface. The measurements needed are collected from the smart device, which is connected to the application of the smartphone, and from the connection to the internet the data are sent to the interface. The healthcare professional is able to monitor the result and provide further instructions if needed. Glucose monitoring. Glucose monitoring. One of the most known chronic disease is diabetes. Diabetes occurs for abnormal functionality of the pancreas gland. The main task of pancreas gland is the production of insulin hormone, which controls the glucose level of the blood. When the pancreas produces less or no insulin, the blood sugar can be up and down, which can lead to vital internal organ damage. The use of IoT application in combination of smart wearables or embedded body sensors that can continuously monitor and send data of the sugar level in the blood, can minimize the risk of death by diabetes. These smart devices, that can test the blood sugar level at any time, are important in understanding the diabetes and how different foods, medication, and activities affect the patient's diabetes. By keeping track of the blood glucose, the doctor can help the patient by creating a plan to manage its condition. These devices are cooled glucometers and are portable blood glucose meters that check the blood sugar levels. They work with analyzing a small amount of blood, usually from a fingertip, where a lancet lightly pricks the skin in order to obtain a small amount of blood. The meter can tell the patient its current blood sugar. However, the blood sugar level changes frequently and needs to be tested often and be recorded. Connected Smart Inhaler. Connected inhaler. Asthma is a not curable disease, but it can be controlled with the use of an inhaler. The symptoms of an asthma attack can be realized by a patient from half an hour to 8 hours before it happens. Application of healthcare IoT can provide smart solutions with the use of a sensor-connected inhaler. A connected smart inhaler can alert the patient by triggered factors, such as air pollution, temperature, in order to prevent an asthma attack. The use of a connected inhaler is combined with a smartphone application where accurate monitoring of the current status can prevent future attacks. Doctors will be able to track the status of illness and notify the patient if the use of inhaler is necessary. Calculates data found from the sensor and suggest patients take necessary steps. Connected contact lenses. Connected contact lenses. One of the most extraordinary human organ is the eye. Tears are the most important factor of the eye, which create a thin layer of it in order to keep it working. However, tears are able to do more with the help of IoT-based contact lenses. The combination of sensors and contact lenses will be able to detect symptoms of various diseases. An example of possible by IoT-based contact lenses detection is an early diabetes detection from the tear glucose levels. The sensor-based contact lenses are the equipment for research in order to provide a solution of presbyopia, the disease caused by loss of elasticity of eye lens. In addition, a smart contact lens that can detect the changes of the eyeball size, called triggerfish, can extract the symptoms of glaucoma. A future direction of these devices is the possibility to dispense medication to the eye, which is better than using eye drops. Smart watches for depression. Every year lots of people take treatment for depression. Recently, Apple started working on their smartwatch to add the ability in detecting depression levels. This device can track and suggest actions in case of depression. This can be an innovative example of artificial intelligence or machine learning in healthcare, that can help the prediction process of the depression level of users. The application is able to assess and monitor the patient's depression level and store the data in the cloud. Through there, the psychologist can understand the insight of the patient's problems by monitoring from the distance. Researchers are in progress of developing more apps that will connect sleep cycle and fitness activity in order to cure depression. Parkinson patient monitoring. Patients that suffer from Parkinson are needed to be observed at every moment, which is feasible with the help of IoT application in healthcare. A movement disorder API can detect abnormal footstep, as well as instability of stride length in patients to draw a graph pattern. The doctor can analyze and check the collected data from the cloud and suggest to the relatives of the patients what to do. These devices can analyze every pattern of the patient and notify the physicians. Additionally, the devices are possible to provide an early detection by analyzing the symptoms. One Ring. The One Ring is a smart ring that can identify Parkinson's motor symptoms. The main idea is that the ring is placed on the patient's finger and generates daily patient reports that help the healthcare professional to prescribe medication more accurately. How does it work? The users wear the ring during their day and information about their movements are transferred through the low-energy Bluetooth connection to the smartphone application. The connection of the smartphone to the cloud makes the healthcare professional able to monitor these information during the day or at the patient's appointment. The smart device can detect changes in response to time, reactions to new medication or tremor patterns. Acceleration data is taken from the ring and machine learning algorithms compare the data to different issues associated with Parkinson's. The ring was trained to identifying bradykinesia, dyskinesia, and tremor. European Project REM-Park. The European Project REM-Park, which stands for Personal Health Device for the Remote and Autonomous Management of Parkinson's Disease, uses devices with IoT technology in order to process information about the patient's disease. A Bluetooth low-energy sensors is worn on the waist and wrist with a control unit that processes movement data and are wirelessly connected to a smartphone. The wrist sensor identifies muscle tremors and the waist belt can measure body movements that include gait. An actuation part of the system provides audible, visual, and touch-related cues by electrical stimulation, in order to get the patient moving again after an episode of gait freezing. It also includes a wireless infusion pump to deliver medications. The monitoring and actuation components are linked to each other with the use of a smartphone, which is responsible for sending data to and from healthcare professionals responsible for the patient's care. Mobile health or mHealth is the way of watching and taking care of someone's health via mobile. Mobile health or mHealth is the way of watching and taking care of someone's health via mobile. The mobile health contributes heavily to both critical situations and regular treatment instances. The use of smartphone applications serve as the management means for health tracking devices. Such apps can be used as your full-blown healthcare hub where you can access valuable medical info, analyze your organism behavior trends, manage other body-inserted IoT sensors, and contact your doctor with a single tap. This is an especially valuable solution for underdeveloped countries of the world where people can't afford regular visits to hospitals yet, most probably, have smartphones. And governments, in turn, get a capability to see how the population is doing in terms of health, accumulating massive statistics. mHealth applications have different types that depend on the goal of their task. Symptom checkers, where the app is responsible to examine symptoms for a specific disease or purpose. Healthcare professional finders, where the app can help the user find a healthcare professional in respect of its needs, including type of professional and location. Managing clinical and financial records, where the app is responsible to manage all the clinical and financial records of the patient. Condition education and management, where the app can help the patients to manage as well as educate them about a specific condition. In most cases, these apps are about chronic diseases. Self-monitoring, where the app can help the user to monitor itself. In these type of apps, the user is responsible to add different symptoms about its condition in daily basis or the app can track activity for the user based on his preferences. mHealth examples. Medication management apps are mobile application that can easily manage the medication information of the user. Initially, the user is able to enter the information about each medication taken, by including the name, dosage, as well as how and when the medication is considered to be taken. The application is able to schedule reminders daily, weekly, or even monthly. The application is able to adjust the user's needs in case of changing the day and the dosage. Additionally, the application is able to send reminders in cases of refills needed. Fitness apps are applications that help the users in their fitness situations. Whether the user looks to slim down, bulk up, run farther, bike faster, swim better, in order to keep a new resolution or just get healthier, these applications are able to help the user meet his fitness goals. Different applications are perfect for different goals based either on the type of the user using it or the purpose of the apps. Different fitness level create different applications, where some applications are about users that are already athletic and some others are about beginners. Different main goal of the app create different applications, where some applications are focused on one area, like nutrition or music for workout, while others are about all-in-one approach. Sleeping tracking apps are smartphone application that the user tracks his sleep patterns. These type of applications track the user's sleep in order to provide sleep patterns in response some actions of the daily life of the user. For example, if a user starts a diet or exercise, by tracking its sleep habits, the app can provide a sleep pattern that can be helpful for the user for do and don't. Some applications can track the different stages of sleep a user changes during the night, as well as provide improving information for a better sleep experience. Pregnancy monitoring apps are a smartphone application that help women monitor throughout their pregnancy. These apps are able to combat morning sickness, keep track of the scheduling for the doctor's visit, inform about taking prenatal vitamins. Additionally, the most important part of these apps is to guide the pregnant woman of her current state day by day as well as week by week, with tracking the baby's growth when the due date is plugged in. Smart hospitals are the traditional hospitals that adopt IoT technology. Every hospital focuses mainly for a quickly care for the patients. These processes are often delayed due to time-consuming procedures that need to be done. The idea of a smart hospital aims in avoiding these problems, through interconnection of all instances and integration of the most modern communication technologies. A smart hospital is created when the whole healthcare organization ecosystem consists of connected medical devices are connected to clinical information systems. The motivation to move from a traditional hospital to a smart hospital environment is about comprising optimized and automated end-to-end processes, as well as IoT components. The introduction of IoT technology comes with new capabilities in patient healthcare. The objective of a smart hospital are defined as follow: remote medical care, enhanced patient safety, cyber resilience, trustworthiness, improved diagnostics and surgical ability, and seamless patient flow. Smart hospital objectives. The introduction of IoT devices in the healthcare context relies on the ability to extend the hospital borders and provide remote medical care. Various medical devices, such as implantable devices, wearable devices, and other mobile ones, introduce the ability to perform real-time patient monitoring through measurement of key vital signs. These measurements are readily available to all hospital staff and system via the network connections. With these type of care, patient admission to hospitals can be limited, which results in reduction of patient care costs and improved patient experience. Enhanced patient safety. Enhancing healthcare delivery and patient flow also increases patient and clinical safety. It is important though that healthcare delivery and patient flow do not improve at the expense of safety. Without doubt, properly used, devices collecting data about patient vital signs and medication intake, or monitoring life support machines, can lead to increased patient safety if they are connected and able to provide timely warning. Cyber resilience refers to the ability of a hospital to ensure the availability and continuity of its services that rely on ICT assets. Higher ICT penetration inevitably leads to greater ICT dependency, which, in turn, increases the relevance of information security for smart hospitals. In some European countries, the health sector is considered a critical infrastructure to be particularly protected. Healthcare actors including hospitals need to anticipate, prepare for, and respond and adapt not only to incremental change but also to sudden disruption. In smart hospitals, achieving this is more challenging than in traditional hospitals because the number of components that could lead to and be affected by service unavailability is much higher. Trustworthiness. Being perceived as trustworthy and having a good reputation is a competitive issue in areas where choosing between different providers is an option. Trustworthiness also affects adherence to medications and continuity of care, which has implications for the outcomes a hospital can achieve. Being at the forefront in terms of ICT usage clearly provides reputational advantages. At the same time, patient safety and privacy must not be put in jeopardy to avoid damaging reputation. Seamless patient flow. Efficient healthcare as well as efficient patient flow can reduce waiting times and the duration of hospital stays, reduce errors, increase revenues and boost patient and employee satisfaction. ICT can be deployed to identify, analyze, and resolve bottlenecks and thereby contribute to efficient healthcare and patient flow. In smart hospitals, efficient healthcare and efficient patient flow may, for instance, be supported by automatic updates of medical information across network devices and information systems. The resulting availability of patient information in all stages, from entry to exit, and the optimization of admission, scheduling and other processes around it result in seamless patient flow. Improved diagnostics and surgical ability. ICT does not only enable new treatment methods, such as surgical robots can perform microsurgery, which cannot be done by clinicians, but can also improve existing methods. Hospitals are increasingly able to mine patient data to help with diagnosis or choosing the best course of treatment, and sophisticated software solutions are allowing them to fine-tune their administrative processes. Electronic health records, EHR. One crucial piece of the puzzle of smart hospitals is the electronic health record or electronic medical record. The goal of this piece is to digitalize all patient records in the cloud in order to have a direct access during office visits or hospital stays. The cloud needs to be able to collect different types of information for each patient's clinical picture that includes diagnostic findings, allergies, prescription data, laboratory data, X-rays, electrocardiograms and medications. This is a beneficial result for the treatment and care of patients. In cases of emergencies, just a quick look at the virtual database will be valuable because hospital staff can immediately learn about a patient's pre-existing conditions and drug allergies. Patient data can be analyzed by using statistical methods that can lead to better preventive health care. Healthcare IoT, advantages. Healthcare IoT can simultaneously report and monitor patients. This approach is beneficial for the following reasons. Real-time monitoring via connected devices can save lives in event of a medical emergency like heart failure, diabetes, asthma attacks, etc. This is possible due to the use of smart medical devices connected to a smartphone app. The smart medical devices are connected in order to collect medical and other required health data and transfer these collected data to the doctor or physician. The IoT device collects and transfers health data, blood pressure, oxygen and blood sugar levels, weight, and ECGs. These data are stored in the cloud and can be shared with an authorized person, who could be a physician, the user's insurance company, a participating health firm or an external consultant, to allow them to look at the collected data regardless of their place, time, or device. Another benefit of healthcare IoT is the end-to-end connectivity and affordability. The use of IoT technology in the area of healthcare enables interoperability, machine-to-machine communication, information exchange, and data movement that makes healthcare service delivery effective. The connectivity protocols used in these devices consists of Bluetooth LE, Wi-Fi, Z-Wave, Zigbee, and other modern protocols. IoT can automate patient care workflow with the help of healthcare mobility solutions, as well as other new technologies, and next-gen healthcare facilities. Additionally, Healthcare personnel can change the way they spot illness and ailments in patients and can also innovate revolutionary ways of treatment. Data assortment and analysis. If accessing the cloud is unavailable, the data is hard to store and manage for real-time application that healthcare devices send at short time periods. Healthcare providers need to acquire data that originating from multiple devices and sources, as well as analyze them manually is very tough. However, IoT devices are able to collect, report and analyze the data in real time and cut the need to store the original data. This procedure is important because the providers are only getting access to final reports with graphs. Moreover, healthcare operations allow organizations to get vital healthcare analytics and data-driven insights which speed up decision-making and is less prone to errors. Tracking and alerts. On-time alert is critical in event of life-threatening circumstances. IoT medical devices are able to collect vital data and transfer it to the doctor in real time, in order for real-time tracking while at the same time dropping notifications to people about critical parts via mobile apps and other linked devices. Reports and alerts give a firm opinion about a patient's condition, irrespective of place and time. It also helps make well-versed decisions and provide on-time treatment. Thus, IoT enables real-time alerting, tracking, and monitoring, which permits hands-on treatments, better accuracy, apt intervention by doctors and improve complete patient care delivery results. Remote medical assistance. In event of an emergency, patients can contact a doctor who is many kilometers away with the smart mobile apps. The medics are able to instantly check the patients and identify the ailments on the go with the use of mobility solutions. Also, numerous healthcare delivery chains that are forecasting to build machines that can distribute drugs based on patients' prescription and ailment-related data available via linked devices. Research. IoT for healthcare can also be used for research purposes. It's because IoT enables us to collect a massive amount of data about the patient's illness which would have taken many years if we collected it manually. This data thus collected can be used for statistical study that would support the medical research. Thus, IoT has a great impact in the field of medical research. It enables the introduction of bigger and better medical treatments. IoT is used in a variety of devices that enhance the quality of the healthcare services received by the patients. Even the existing devices are now being updated by IoT by simply using embedding chips of a smart devices. This chip enhances the assistance and care that a patient requires. Healthcare IoT, disadvantages. The most significant threat IoT poses is data security and privacy. IoT devices are responsible to capture and transmit data in real time. However, there is a lack of data protocols and standards. Additionally, there is also a significant ambiguity in regard of data ownership regulation. All these factors make the data highly susceptible to cybercriminals, which can hack into the systems and compromise personal health information for both patients and doctors. The cybercriminals are able to misuse patients' data in order to create fake IDs with purpose to sell different drugs and medical equipment. They can also file a fraudulent insurance that will claim the patient's name. Integration, multiple devices and protocols. The integration of multiple devices can cause hindrance in the implementation of IoT in the healthcare area. This is happening because the device manufacturers have not reached a consensus in regard of communication protocols and standards. As a result, even that the most devices are connected, the process of data aggregation is complicated and hindered due to the difference of the communication protocol. This non-uniformity of the connected devices protocols is able to slow down the whole process as well as reduces the scope of scalability of IoT in healthcare. Data overload and accuracy. While the data aggregation process is difficult in result of different communication protocols and standards, the IoT devices still record a lot of data, which are utilized to gain vital insights. However, the tremendous amount of data is becoming extremely difficult for doctors, which results in ultimately affects the quality of decision making. Moreover, this concern is rising as more devices are connected which record more and more data. Cost. While IoT promises to reduce the cost of healthcare in the long term, the cost of its implementation in hospitals and staff training is quite high. In this part we have seen the general idea of healthcare IoT. We started by providing the definition of healthcare IoT and continue by giving different examples. Then we describe the terms of mHealth and smart hospitals. The mHealth category provides the definition, different types, and examples. The smart hospitals category provide the definition, objectives, and a component. We conclude with presenting the advantages and disadvantages of healthcare IoT. This concludes on our presentation of the healthcare IoT solution.